This is an ultrasound study of a 15 years old young boy with a history of right subcrotal pain and swelling, and we are seeing the left testis first in longitudinal section, and it measures approximately 3.8 centimeters by 1.9 centimeters, and this central linear black echogenic line is the mediastinum testis. It is normal, so the left kidney is normal in its echogenicity, mild coarse homogeneous, and this is the subcrotal wall showing mild thickness. Small amount of fluid is seen. Posterior to the testis. Now I'm going to move the probe towards the right side, and here you see this is the right testis. Patient is extremely tender. This is the left testis, and you can see that it shows heterogeneous appearance. The mediastinum testis is not visualized. There are a few focal lesions, echogenic. This is an echogenic area surrounded by a halo at the medial margin of the right testis, but this linear structure, this structure is suggestive of mediastinum testis, which is intact. So the testis is not that badly damaged, though there are multiple lesions seen. This is another lesion, and this is another lesion. And you can see that the wall is thick. This is the wall of the right hemisubcrotum. Measures approximately 7.7, and the testis measures 3.7 by 2.3 centimeters. This is another small echogenic focal lesion with halo around. There is a row of very tiny calcifications seen. These are few tiny calcifications seen. This is the longitudinal view, and in this longitudinal view, when I try to, now you see the epididymis. This is the epididymis. This area is the epididymis with, hypoechoic area measuring approximately 8.8 into 7.2 centimeter, with another sub-centimeter hypoechoic focal lesion seen in the right epididymis, as it measures 2.5 centimeters in length and 1.29 or straight away 13 millimeters. So the measurement of the epididymis is enlarged. There is a focal lesion here. There is a focal lesion over here, and the echogenicity is inhomogeneous. So this is epididymitis. Epididymis. This is the testis. That of the right side. and you can see that the outer margin of the testis is irregular. This is the outer margin. See the irregularity of the outer margin and small amount of fluid surrounding the outer margin of the right testis. With a few focal lesions seen scattered throughout the testicular parenchyma. Again, see the epididymis. Epididymis is enlarged and shows a few internal scattered hypoechoic areas. This is the epididymis, comma-shaped area. Is more echogenic than the adjacent testicular parenchyma. This is the testicular parenchyma, small amount of fluid posterior to it, thick wall, and the epididymis shows appears more echogenic compared to the rest of the testes. So this is orchitis testis. This is orchitis with epididymitis. Right testis in a longitudinal section. Now moving further towards the inguinal region, we don't see any herniation of the bowel. No significant fluid is seen within the hemiscrotum. Now this is the picture of the testes. See the echogenicity and multiple internal focal scattered focal lesions in transverse section. This is the transverse section, and this is also the transverse section. This this view was taken to show you the mediastinum testis, which is normal, and this is the transverse section showing you multiple irregular focal lesions scattered throughout the testicular parenchyma, that of the right side. This is the, let's compare the both testes. This is the left, this is the, sorry, this is the right testis, this is the left testis. See the difference between the echogenicity of the two. This is the normal echogenicity, homogeneous, mild coarse echogenicity, and with no focal lesions or seen within the testis, homogeneous. This is the scrotal wall, and now compare it with the right one, which is suggestive of orchitis, and this echogenicity is less as compared to that of the left testis. So the right testis shows diffuse decreased echogenicity, and we did so multiple small, tiny to 8.9 to 7.2 millimeter focal lesions, and a few echogenicities were and a few tiny echogenicities were seen, tiny calcifications, and a small amount of fluid is seen surrounding the testes, whereas it is not enough to be labeled as hydrocele. No varicoceles are seen in this testis. So this is a case of epididimo orchitis. Thank you.